Hi, this is Dr. Tom Rogers, the Common Sense Doctor, on the weekly podcast. Today, I'm going to be speaking to mostly men over 40 who are concerned about their prostate. Take it from a guy that's old, me, 66, who's had prostate problems through the years. I speak from experience, and also I speak from treating a lot of patients through many years. And when you're involved in men's health, you got to keep an eye on the prostate. But most, we screen for prostate cancer, of course. We've talked about that many times with PSAs. We even order MRI of prostate, hopefully before you have to get a biopsy if your PSA is really rising quickly or your prostate exam is abnormal. But what I want to focus on today is enlarged prostates, BPH, benign prostatic hypertrophy. And that's where, as you age, your prostate grows. You get more prostate cells and they get bigger. And you think, what's the cause of this? In integrative or functional medicine, we try to find the root cause to problems rather than just, throwing another medicine at you. And certainly there are multiple prostate medicines out there because this is a condition that affects millions of men, including myself. What happens is that as you get older, almost invariably, for most men at least, you have a difficult time urinating. Maybe starting the stream or have to get up at night one or more times. It really can be very disturbing to your sleep and is one major reason for sleep problems, in my opinion, for missing out on that deep quality sleep. But, it can cause some sexual dysfunction also. And what can cause even more sexual dysfunction are some of the medicines that we treat it with, like Prostate, which is finasteride, which is supposed to shrink your prostate down, but can cause a lot of sexual dysfunction that you don't want. And it takes about at least 6 months to work, maybe half the time. Usually, when I put people on the full dose of this for prostate, they just can't continue it. So not many people continue this. Interestingly, I do use a very small dose of this to grow people's hair if their hair is thinning, and it works real well for that. So finasteride maybe shrinks your prostate and definitely grows hair on your head. There's other medications that can temporarily help symptoms like Flomax. That's one that kind of helps with a urinary spasm more, relaxes smooth muscles so you can urinate better at night. Seems to help. There can also be some sexual side effects with that one also. I don't want to get too graphic with it, but not a lot of men tolerate this well. Some do. Heck, you do anything if you can't pee, you'll do anything, including self-catheterization. For some men, it comes to that. And there are variations of Flomax out there, like Rapaflo, which is a newer one. I haven't found it to be much more effective than just generic Flomax. There's procedures you can get also. You can get something called a TURP, which is reaming out of your prostate. That's not a fun one to get. Or you can have steam in there. There's all kinds of newfangled things they're doing. One is called the UroLift, where they put these brackets in there that just kind of open up and get your prostate, and you can have room to pee. The prostate surrounds a urethra, and as it grows, it squeezes that urethra, which is the outlet between the bladder and the outside of your body. And the prostate just sits kind of between them and really causes a lot of problems in men. But let's talk about the root cause of the problem. For years, people thought it was testosterone. And that's why they were hesitant about giving testosterone to men, because it caused enlarged prostate or maybe even prostate cancer. Well, newsflash, it's been proven it does not cause swelling of your prostate, and it certainly does not cause prostate cancer. So that's kind of off the table now for most people that are in the know. Estrogen can certainly cause your prostate to swell, for sure. That's why I tell people to avoid products like soy products. But that testosterone to estrogen ratio, as you get older, your testosterone levels decline, your estrogen levels don't. So that testosterone to estrogen level gets smaller, and that can affect your prostate. So I look at the estrogen level pretty closely with prostates, because it is a factor in that. But the main hormone that turns out that can affect your prostate and make it grow when you don't want it to is insulin, that age-old hormone that I talk about all the time with nutrition and diabetes and, the nutritional pathway of insulin. Well, if you have a lot of insulin in your body, and the way you get that's by eating too many carbs, insulin is a growth factor. It makes certain things grow faster. When you're young, you want things to grow faster, like your muscles. When you're old, you don't want to go through that growth phase, because you don't want your prostate to grow, and you don't want if you had some cancer cells in there, you don't want them growing either. So you reach a certain point in your life where you want to maintain, you don't want to grow. And the IGF-1 level, which correlates to how much growth hormone you have in your body, it's just a more accurate measurement of that. It's something called IGF-1. We check it in our office a lot. And if it's too high, then it can cause prostate growth, and also probably cancer in any organ if your IGF-1 level is too high. So you don't want it to be naturally too high. IGF-1 stands for insulin-like growth factor. So think about it. Insulin and growth factor, very interrelated. So insulin definitely stimulates growth of your prostate. Insulin also makes you fat, makes you hungry all the time, and that fat is distributed around your abdomen. Belly fat is insulin resistance. And, of course, insulin is a hormone that's secreted by your pancreas in response to carbohydrates or sugar, glucose in your bloodstream. The job of insulin is to put the sugar from your bloodstream into the cells for energy. And if you're eating too many carbs, which sugar is just the worst carb, then you get insulin resistance. So you get very high insulin levels because it doesn't work very well to keep your sugar within a normal boundary range. So I check a lot of insulin levels. And if they're high, either fasting or non-fasting, you have to take action. I use medications to bring them down, of course. A lot of what we do in performance medicine is get people to lose weight. But the main thing is you need to learn how to eat. That's why a low carbohydrate diet is vital for everything, not just weight loss, but it turns out to keep your prostate from growing too large. So that's why ketogenic, when people get on keto diets, their prostate shrinks. It's not overnight, but it will definitely shrink, and you'll become much less symptomatic. It's hard to stay in keto. It really is. A better way to do it is to do intermittent fasting, which puts your body into ketosis for part of the day. That's a much more doable thing, and I certainly have been doing it for a while, and I think it's really helped my prostate. I go for 17 hours with not eating, 7 hours eating, and sometimes I'll go on a whole day fast, and it seems to rejuvenate me, mind and body. Definitely gives me more energy, and it's easier in the morning. I just don't eat breakfast. I don't have to worry about fixing breakfast or eating something that's carby, and then an hour to 2 hours later getting hypoglycemic. and which happens a lot from too much insulin. Your insulin is overreactive. And then as it dulls out and you become insulin resistant, boom, you have type 2 diabetes, which is a worldwide epidemic of this right now. I mean, if you're a diabetic and get COVID, you're going to do a lot worse than somebody who isn't diabetic. And you can turn that around pretty quickly just by getting on low-carb diet. And when I say low-carb, of course, I mean fruits too. You know, fruits are just sugar. They're fructose, which is actually worse than sugar because it doesn't signal your insulin or your satiety hormones as well. Sure, there may be some good vitamins in it, but it's just the risk of it far outweigh the vitamins you're going to get from that. Just take vitamins. Don't get your vitamins through eating high glycemic fruits. Now, the berries are okay. I'm fine with them. They're low glycemic and actually good for you. But like bananas and grapes, mangoes, cherries, very high glycemic. So avoid these if you can, just like you avoid sugar. Don't eat whole wheat bread. Remember, when you eat bread, even whole wheat bread that's supposed to have fiber in it, which it usually doesn't because it's usually been processed out, I mean, that gets in your mouth, and as soon as those enzymes in your mouth act on it, it turns to sugar. So the whole wheat thing is totally out. Avoid soy. That's very estrogenic. You want that testosterone estrogen ratio to be high, not low. You want less estrogen in your body. And another way to have too much estrogen in your body is to be fat. If you really have a lot of abdominal fat, it aromatizes, which means changes into estradiol. When I replace a man's testosterone, I'm always very careful to look at those estrogen levels. Sometimes I use estrogen blockers. Sometimes I use DIM and certain other nutritional additives. But anyway, prostate, very interesting, vital to a man's manhood, but can really cause a lot of problems later on in life. I can't tell you how many of my friends have already had the prostates biopsied or operated on, or they're having bad symptoms every night or going to the bathroom during the day multiple times. It's not good. An enlarged prostate is very, very common. So don't worry about testosterone. Do worry a little bit about estrogen. Keep an eye on that. But worry more about insulin, that growth hormone that causes prostate enlargement. Insulin, another reason to get on a low-carb diet and to do some intermittent fasting. If you're having problems or questions about your prostate, certainly come into the office and we'll look at it and see if we can't find you some help. Thanks. This is Dr. Tom Rogers. I'll see you next week.